Back labor is the worst. If you've experienced back labor, you know what I'm talking about. Let's talk about what causes it and what we can do about it during pregnancy and during the birth itself as well. One of the biggest causes of back labor is baby's position. So when I say back labor, I'm not talking about just feeling the sensation of the contractions in the back of the pelvis. As baby is dropping deeper into the pelvis, it is normal to feel those sensations in the sacrum and in the tailbone and eventually in the rectum as baby's making their journey down. So do not stress if you feel sensations in your back that your baby's in a bad position. I have seen a lot of people get really stressed out during their birth when it was just a normal place to experience the sensations of the contractions. When I'm talking about back labor, what I'm talking about is extreme, intense, overwhelming pain in the back during this process. And it's typically associated with a baby in what's called an OP, or a posterior position, where baby's spine is against the birther's spine, right? And so the other thing that goes along with baby in this posterior position, sometimes known or called sunny side up, because they're looking up, you know, they're this way. And if this was my body, the baby is this way instead of the more optimal this way. So when a baby is in this posterior position, our spines are together and their occiput is against the sacrum. A couple different issues with that is when baby is in this position, they find a more extended position to move through the pelvis. So baby in a more extended position is a lot larger of a surface area. And so that can make this process be longer and stronger, and there can be more delays. And so for most pelvises, this is not an issue for all pelvises, but for the majority of pelvises, we want to see a baby in a more anterior position. This is known as left occiput anterior, right? And what happens when baby is in an anterior position is that they can tuck their chin, and now it's a smaller surface area making its journey through the pelvis. So back labor associated with a baby in a less optimal position, and it is our body communicating a need for balance. So let's look at some ways we can balance the body during pregnancy to prevent back labor, and during the birth itself to help baby rotate around to a better position. Babies accommodate the space they are given. So if there is an imbalance in that space, a torsion, a tension, the baby is going to move away from that somewhere else. Babies want to find the best position. They're not being bad. They're just accommodating the space they're given. So if there is a twist or a torsion or a restriction somewhere in the uterus, they're going to move away from that. And maybe that means they need to turn posterior or breech or some other position. And so our goal during pregnancy is to create as much balance as possible for the baby to be able to rotate and find their best position to move through the pelvis. So we have so many videos throughout our platform and inside our programs to help you identify patterns in your body to help create some balance to help baby have the most balanced space to navigate. So that is stacking the cards in your favor for a baby in a more optimal position. But what can you do during the birth itself if you're like, I am experiencing this intense back labor, or my client has experienced this intense back labor? What can we offer them? Well, first, it depends where baby is in the pelvis, what we're going to offer to create balance for where baby is and what tissues that they are interacting with. But in general, if baby is getting into the pelvis, we could do something like the abdominal tuck and lift, which is a really great tool for helping with that drive angle of the uterus to help baby rotate into a better position. The forward-leaning version is a really great technique by Dr. Carol Phillips that was literally developed when they were taking a mother down the stairs head first on a stretcher who was having a really long, intense back labor situation. And when she got to the end of the stoop, the baby came out. They wondered what was happening. And it was that they were able to bring baby up and out of the uterus a little bit, reposition them as they release the ligaments that were also creating that twist or torsion, bring them back up, and now the baby was able to reposition and move through with greater ease. And so the forward leaning inversion is a really great option if baby's in the inlet or mid pelvis. When baby gets to the outlet, we're gonna probably do some different things to just get them out posterior. But when baby is kind of delayed in the inlet or mid pelvis, we can do a lot of different techniques to help support them moving into a better position. Anything that's going to create balance is going to encourage baby to rotate and find their better position. So if you're a doula and you're like, wait, I have 5 other options. Yes, we do. And that is why you're so important in the birthing room, because you have those skills to be able to identify what's going on, what is this body communicating with me, and how can we invite in balance so that this birth can be a little bit less intense and a little bit more efficient. What can you do during the birth itself if you're experiencing back labor? So back labor is an invitation for balance. It's the body trying to communicate a need to us. And the need is baby gonna fit through the pelvis in this position? It's a bigger surface area, it's more challenging. Can we invite imbalance so that baby can rotate into a more optimal position to be born more efficiently and with greater ease? So there's a couple different options depending on where baby is in the journey. If baby is high in the pelvis, we can do an abdominal tuck and lift. This is gonna change what's called the drive angle of the uterus, and it's gonna help baby to rotate into a better position. You really need to do that through 10 contractions. So it takes a while, but you'll find after 10 that baby will have a lot of the times rotated, and now we're cooking with gas, so to speak. At the birth, it's honestly really more of the same. It's knowing how to read that birthing body if you're a professional and understanding what it is asking for. So if someone is experiencing really intense back labor, we could sit on our hands and we could say, well, statistically that baby's gonna eventually rotate to anterior anyway, so I might as well just wait and do nothing, right? And that's definitely an option, and especially if that's what that family wants and you are in a setting where that feels doable. But for a lot of people, there's this balance of let's be a little bit proactive at the birth to prevent this longer labor that can occur with this posterior birth. The baby is taking their journey to rotate before they're really gonna drop down. And so let's encourage that. Let's support that. Let's support that baby. Let's support that family. The specific techniques that we're going to use to help baby rotate into their best position, say posterior to anterior in certain pelvic types, depend on where baby is in the pelvis. So if baby is still trying to get into the pelvis, we want to create balance for them to be able to rotate. So I look at the psoas, I look at the QL. In our Body Ready Method Pro Training, we teach you all these different tools to encourage that balance to help baby rotate. I also really love the abdominal tuck and lift. That one is going to be most effective with consistent contractions. So if someone's super early and they have kind of inconsistent contractions, I would probably go to more different tools, and once they get a regular pattern, you could go to the abdominal tuck and lift.